Hi, my name is Jeff Daley. I'm a physical therapist at Physical Therapy and Sports Medicine Centers in New London, Connecticut. I graduated from Sacred Heart University with my doctorate in physical therapy in 2014. Today I'm here to talk to you about low back pain. Low back pain is something that a lot of us have had, or we have a friend that has low back pain and it's debilitating. We use our backs for everything during the day, so when it hurts, it's tough to do things without pain. The reality of low back pain is that 40 to 80% of adults will have low back pain at some point in their lives. About 40% of adults will have back pain this year. And it's really common once you have back pain for it to come back. Where we come in is to help you move, to help you exercise, stretch, whatever it is that you need to help your back function properly. We take a look at what might be causing your pain and use parts of your body to help you move better. So there's a lot of common causes for low back pain that all of us probably are guilty of at some point in our lives. Those are having poor posture, not lifting things properly, and not exercising enough. Physical therapists can help identify issues with your movement and also help teach you to move properly to help either improve your pain or avoid pain in the future. So once your back pain is evaluated, a treatment plan will be provided by your physical therapist. The treatment can be exercises, it can be stretches. Physical therapists are also trained in different soft tissue mobilization techniques. We can use things like dry needling. Dry needling is the use of a monofilament needle, like in acupuncture, but instead of using like meridians and different concepts of Eastern medicine, the needle is just meant to directly affect a muscle that might be in spasm or tight that could be preventing movement or preventing muscles from working properly. It's a quick and safe treatment that a lot of physical therapists in our company and in Connecticut are trained in. Grafting is another really effective technique that physical therapists in our company are trained in. Grafting is the use of specially made pieces of stainless steel that can help loosen up muscle, fascia, promote healing in your soft tissue. So again, physical therapists are very well-rounded and very capable to treat your low back pain from a variety of angles. So a lot of people ask, well, can I go see a physical therapist for my back pain before I see my doctor? And the answer is yes. In the state of Connecticut, we have direct access. So you can come straight to a physical therapist, depending on your type of insurance, and get an evaluation for your low back pain. Physical therapists are trained to evaluate all parts of the body. So if the decision is made that you have low back pain and you're appropriate for physical therapy, we can develop a comprehensive treatment plan to get you back moving, back to the activities that you like to do, and doing those things safely.